And so today I wanted to outline the next step, a new NHS app for contact tracing. If you become unwell with the symptoms of coronavirus, you can securely tell this new NHS app. And the app will then send an alert anonymously to other app users that you've been in significant contact with over the past few days, even before you had symptoms, so that they know and can act accordingly. All data will be handled according to the highest ethical and security standards and would only be used for NHS care and research, and we won't hold it any longer than it's needed. And as part of our commitment to transparency, we'll be publishing the source code too. We're already testing this app, and as we do this, we're working closely with the world's leading tech companies and renowned experts in clinical safety and digital ethics so that we can get this right. I want to thank all of these world-leading experts who've been involved. The more people who get involved, then the better informed our response to coronavirus will be, and the better we can protect the NHS.
One possible tool to find the route out of lockdown could be via a mobile contact tracing app, which would alert people if they've come into contact with an infected person. It would mean that people could leave their homes safe in the knowledge that they have not got the virus. I'm joined now by Professor Christoph Fraser from Oxford University's Nuffield Department of Medicine and Big Data Institute. He is the co-lead on their mobile tracing app project. Professor, thank you very much indeed for being with us. So just tell us about the app and how it works.
Right. So the app is being developed by NHSX, an organisation, a joint organisation of the NHS and the Department of Health, and the app works by storing anonymous IDs. So when you're in proximity to individuals, if both individuals have the app installed and have consented to this information being exchanged, such that you have as you go about your life, you build up, your phone builds up a memory of whom you've spent time with, and then scores them in terms of how risky those events were. And in the event that you become diagnosed with COVID, that you develop the symptoms of COVID, you can then record yourself as a case, and you can upload those. You can then pass the information to the people you've been in contact with, some of which you will know, and some of which you may have been on the bus next to, and they will receive a notification that they are at risk of having been infected. And therefore, it doesn't protect you from infection, but it protects the community because it empowers you to take action, to self-isolate, or maybe for your household to self-isolate, and to prevent the spread of the virus across the community. So as we come out of lockdown, it allows you to think about contributing to stopping the resurgence of the virus. And protecting the NHS and vulnerable people.
In order for it to be most effective, you need, what is it, about 60% of the population to sign up to this app. Is that feasible? Is that realistic, do you think?
Well, so what we've been doing is exploring through simulations and through a wide range of simulations and a wide range of assumptions about what we think is going on. And we've been looking at the incremental benefit of of having 10%, 20%, 30% of people installing the app, and critically, the app is giving you the information, but the result is what people do with that information, and so it requires building a system that have trust, and NHSX have been working in terms of having ongoing discussions with members of the community. With people, who rightly concerned about, how this system can maximize the amount of privacy and consent. And through that work, we think in these very unusual circumstances, it's possible for something unusual to happen, namely that a large fraction or a large uptake of this app could be possible. But also critically, our simulations have looked at the incremental benefit. If 10% of people, there will still be some benefit. And of course, we'll have to look at how that fits in with other intervention measures, such as shielding the most vulnerable, such as linking it with community testing, which we know is being planned and the capacity is being built up, and such as improvements in how people can do self-isolation and community mobilization and so on.
Yeah, I mean, there's a couple of points to pick up on, and they're interesting. You talking about the privacy, that you think that people might accept a greater loss of privacy in exchange for potentially greater freedoms. But this app can't work alone, can it? And it requires greater community testing in order for those people with COVID-19 to be identified in the first place, to then be able to tell their contacts that. And that isn't happening at the rate we need at the moment, is it?
So that's interesting. So what we've been looking at in the simulation is the possibility of self-diagnosis and diagnosis based on symptoms. Now, at first sight, that would seem, you would notify contacts potentially based on a false report, but that would still result in far fewer people receiving notifications to self-isolate compared to the situation we're in, which is a lockdown. And so we're looking at the relative benefit of sort of trace first and then test versus the alternative scenario, which is test first and then trace. And our current simulations indicate that actually the trace first and then test might result ultimately in fewer people being quarantined because it has a greater effect in suppressing the epidemic. But that's a policy exploration which many different sides are coming into in terms of refining the action of the app and again phasing that in with the other measures which are being considered as we look to coming out of lockdown.
Professor Christoph Fraser, thank you very much indeed.
But what about the new surveillance techniques introduced to curb the spread? In Hangzhou, to enter a tower block, you need to have your temperature taken and registered. And you must have an app on your phone into which you input your name, temperature, recent travel and ID number. The information generates a color code.
In Hangzhou, to go out of the community or to public activities, you need to have a green code. This green, yellow or red code is automatically decided through the system. It uses big data to decide whether you've been to affected districts or come into contact with those people.
But what if you're well and get a red code anyway? This man says he self-isolated while visiting Anhui province near Wuhan and back home in Shanghai. But there's no way to challenge the technology.
Our office building here, you need to register. You need to show the code to demonstrate that you're healthy. So when I was red, there was no way I could go to the office and work. I didn't do anything. Then after 2 or 3 days, I looked and suddenly it was green. I don't know why. But I think that although it's not really reasonable, it is still a preventative measure.
But few know exactly how their data is being used.
We actually looked at the back-end code that the app was running, and what you could see is the moment that a user gives it permission to access data, it immediately sends a function that says report info and location to police. And then we looked into it, and the police were a key developer of the product as well. And so from that you can tell that the data is basically being sent back to the police the moment somebody actually uses the app.
In some 200 Chinese cities, you now need a green code to get on public transport. Without it, you can do almost nothing. No crisis should go to waste. The coronavirus has given the Chinese Communist Party an opportunity to increase state surveillance, knowing that most people will be more worried about the epidemic than their privacy.
I'm not an expert, but if the government says this is useful, I believe them.
A Chinese company has now developed facial recognition technology that works even if you're wearing a mask. The epidemic has enabled the Chinese authorities to normalize digital social control, something they're unlikely to relinquish. It's been suggested that China's authoritarian leader lost credibility because of the initial cover-up of the epidemic. But in Chinese, the word for crisis is made up of 2 characters: danger and opportunity.
Lindsay Hilson reporting. Well, now, earlier I spoke to the lawyer Nuri Turkel, who is from the Muslim Uyghur community, more than 1 million of whom are currently being held in camps by the Chinese authorities. I began by asking him how the coronavirus is affecting the Uyghur people.
The Uyghur people have been treated as not second-class citizen, but third-class citizen, at least as long as I have been breathing. I never thought that I would be talking about the way that my parents brought me to this world as much as I have in the last 2-3 years, because this oppression used to be bad, but now it's worse. And adding the current health crisis, we worry that if this virus makes it to the camp, we're talking about unthinkable casualties.
Because 1 million Uyghurs are
at least
detained in that
United
camp.
States government estimates anywhere from 2 million to 3 million Uyghurs and other Turkic Muslim being detained in modern-day concentration camps. So, to this day, World Health Organization or other international entities were not granted access to the camps to make sure that at least there's a health care.
Let me bring you then to this app that is monitoring people in the affected areas of China. You believe that, in fact, it is more than simply monitoring the health conditions of the people.
The Chinese government, before the current crisis started, the health crisis, virus crisis started, they already monitoring every aspect of Uyghur lives. So any movement, every movement that you made, even your door at your house has a QR code.
But this is reaching out beyond Uyghurs. This is anybody in the affected areas can be issued with this app.
So this country has already been deeply surveilled, and this new app is adding another layer for the Chinese government, Xi Jinping's China, to monitor their own citizens.
Then, effectively, China has become the first digital dictatorship?
This kind of things that you read normally in the science fiction dystopia, right? Today, the Chinese government not only using these technologies to surveil its own citizens, but also actively promoting that.
But then what you're saying about this app is that the medical crisis that is confronting China is actually enabling them at the same time to deeply penetrate digitally the activities of every Chinese citizen.
Right, that's exactly right. And also it's serving the political purposes of the state. Last year, New York Times reported that there are about 18 countries around the world, including Germany, surprisingly, already looking into the Chinese way of surveilling its own citizens, to make sure that there's no political upheaval cooking up. That includes the voting process or individual voting records.
But if the Chinese ambassador was sitting here right now, he would say, no. What this app is doing is enabling us to look at the medical condition of people suffering from this virus. It's a wonderful thing.
And then the same question be asked, why other countries, countries like UK, the United States, others, don't use that kind of surveillance to monitor the sick people? They put them in a hospital.